Hi, and welcome to tonight's webinar. Um, so tonight we're going to talk about happiness promoters, so herbal solutions for when you're sad. My name is Dr. Blossom Bidding. I'm with St. Francis Herb Farm, and I'm going to apologize right now for anyone who was here on Thursday night when we were talking about herbs for immunity. There will be some reinforcement tonight. You'll be an expert in vitamin D and why tinctures are an ideal way to um, I just want to be sure that I didn't just turn into, I'm sorry, I'm not a Zoom expert. Okay. Um, my vision of myself just disappeared and someone else's name popped up. So I just wanted to be sure that I was still here. Um, so as I was saying, there will be a little bit of overlap from the other night, but a lot of really great new information on the herbs and how they pertain to mood and mental health. So tonight we're going to be going through a little bit about our farm and our company at St. Francis Herb Farm. We're going to talk about the possibilities of is this a mood disorder or the symptom of something else? Because there are, underlying conditions that can present as mood disorders. And then we're going to go through how different neurotransmitters do function in our bodies, some lifestyle support, things you can do at home without taking anything. Vitamin D, like I said, I talked about vitamin D when it came to inflammation, but it's going to be in a different context tonight. So we'll talk about vitamin D and how it pertains to mood. And there is some overlap there. And then we'll get into the heart of the presentation with the mood supportive herbs. And I know that that's what you're really excited to learn about. Um, St. Francis Herb Farm, who I've been an herbal educator with for the past 7 years, is located in Combermere, the Combermere Valley of Ontario, which is just like the outer eastern gate of Algonquin Park. And it's a Canadian company through and through in its second generation of Canadian family ownership. So pictured here, we see Paul and Caitlin, who are the current ownership family of St. Francis, and their three sons, and they live adjacent to the farm where we grow about 17 of the herbs that we use in our singles and our formulas. And adjacent to that is the 33,000 square foot processing plant where we process, package, and distribute our herbs all over Canada and other parts of North America. So I am a naturopathic doctor, so I speak a lot about my clinical experience as well as like the educational factors, the research, and the traditional uses of some of these herbs. So our passion for well-made herbal medicine runs deep. We have some core values that Paul and Caitlin really stick to when it comes to running their business and extending to their employees and to their retail partners like Healthy Planet. And I should mention that when you go to the Healthy Planet website with your excitement about all your new herbal education tonight, you will see that all the St. Francis products are on sale 15% off. So that's a discount that Healthy Planet is extending to you right now. And so it'll help you to experience some of these herbal solutions. So our core values are that the way herbal medicine is made matters. So really what that means to us is that we don't have one single process for the production of our plant. We take the herb, we learn about how to best get the medicinal constituent from it, and we fit the process to the plant. So that may mean processing it fresh. It might mean roasting a root before processing it. It might mean soaking it in alcohol for 6 weeks or 8 weeks. I had a question last time about how much alcohol we use. That will depend on the plant or the part of the plant. So we do make medicines from leaves, flowers, barks, or whole plants. So each plant preparation requires a little bit different process. And when I visited the plant last year, I was just amazed at some of the machinery that had been used for generations in herbal preparations in Europe. And then we've brought them to Ontario and are really perfecting that herbal medicinal extraction with them. We have we really have the philosophy that each herb has a part that provides us with the most benefit. So like I mentioned, that could be the leaves or the flowers, the root or the bark. But we don't take the single constituent from that part. So some herbal preparations will take a single constituent. I'll use the example that I'm going to talk about later on is St. John's wort. Sometimes people will take, or processors will take just the part of the plant that the research is based on. So a lot of times herbal research is done really funded by companies so that they can sell that molecule or that constituent, make a copy of it, a pharmaceutical copy of it, and sell it to a pharmaceutical company to develop it into a drug. So a lot of time the research or a pharmaceutical medicine. So a lot of the time the research is done on these single constituents, and traditional plant medicine uses the whole part of the plant. Not always the whole plant because not all parts have that medicinal quality, but excuse me, certainly that whole part. So we don't extract, in St. John's wort example, we don't extract the hypericum or the hypericin because we use the whole aerial part of the plant. We also really believe that herbal medicines are part of a simple part of healthy lifestyle that really helped to serve the foundation of good health. And I will be talking about lifestyle first tonight, and then the herbs come in secondary to a healthy foundational lifestyle. And we are, like I mentioned before, a Canadian company that really supports the local economy and community as well. So within Barry's Bay, where St. Francis Herb Farm is located, there are a lot of employees from either the processing plant or the farm. It's a small town, and you can really see how much of an impact the St. Francis Herb Farm has on the community. They also really support herbal education at the naturopathic colleges in Canada, as well as supporting many herbal organizations like herbal associations across the country. So they really do a lot of educational and financial support to the herbal community as well. And we're really involved in the production of the plant from herb to shelf. So not, like I mentioned earlier, not all of the herbs are grown on site, but we are involved if they are grown off site in checking in that they're following practices, and all of our growers, our contract growers, are also organic certified. So we're leaving the land better than we found it when we grow organic, and also the constituents are healthier for human consumption from our philosophies. You'll also see that St. Francis Herb Farm is a tincture first company. Most of our products are tinctures, and it's kind of unique. There aren't very many companies that have stuck to this traditional way of preparing herbs. And the reason for that, or the reason we've stuck to that, is that it really is the way that makes plants most bioavailable for the person who's taking the herb. So what that means is it's the best absorption for those constituents of the plant. So absorption can start in the mouth, absorption can continue in the stomach and along the rest of the small and large intestine, depending on the constituent. And there's also actions that happen in the mouth or even before the herb reaches the mouth through the aromatics and the taste of the herb. It's also a great way to extract fresh herbs and keep those constituents as if they were fresh. And most tinctures, when you buy them, have a great shelf life, like 4 or 5 years. So it's a great way to extend the life of the plant. Um, it's also a great way to customize formulas. So tonight I'll be talking about a few different combinations and formulas that we make and distribute from St. Francis Herb Farm. But if you wanted to try a couple of them, oh, my light just went off, sorry. Um, if you wanted to try a couple of them yourself, you could buy two of the single herbs and customize a formula for yourself. So it's really easy when they're both liquid and in this alcohol base to do that. It's also a really easy way to customize dosages. So for example, I love to use our sleep formula, which is called Valericalm as an example. A little bit of Valericalm throughout the day can just be like a calming anti-anxiety effect, whereas a lot of it or the big, sleep enhancing dose before bed can really help someone drift off to sleepy time. So it's a really, really great way to like customize that dosing. And like I mentioned before, sometimes the taste is involved in the action of the plant. So my favorite example of this are bitter herbs, the bitter stimulation to the digestive juices, and the taste is part of what initiates that digestive process when we have the bitter in our mouth, whether it be from herbs or bitter foods. So it's a way to get in touch with what we call the energetics of the herb, be it warming or cooling or kind of um, astringent. So sometimes if you put an herb in your mouth and it's really drying, it also has an astringent action down the entire digestive tract or in the respiratory tract. Um, so again, we do make capsules, and you hear some of them tonight. Um, but we actually make the capsules out of what was originally tincture. So we de-alcoholize the tincture, and it's left with a kind of like a dry, powdery version of the constituents. So if you take one of our capsules and open it onto the tongue, it dissolves like a vitamin C crystal would. Not, there isn't any plant fiber in our capsules. There are two exceptions to that in our lineup if you go on the website tonight and explore. And I'm talking about one of them tonight. Our ashwagandha capsules are not dehydrated tincture. We use the patented molecule KSM-66, and I'll talk a little bit more about why we've chosen to do that. And the turmeric plus capsules or the curcumin plus capsules, which is a turmeric formula, we use a patented molecule called Mariva because it makes that turmeric more fat soluble and able to absorb better that way outside of the tincture. So let's talk a little bit about like I said before, is this depression or a mood disorder, or is it a symptom of something else? So, chronic inflammation can be the root cause of many mood-related symptoms. So, whether that's inflammation that's causing pain, I see that a lot in clinic when people are in chronic pain. It can certainly cause a depressing action to the mood, or even if they aren't in pain, inflammation throughout the body can interfere with absorption, it can interfere with metabolic processes, and that can lead to depression as well. So when we talk tonight about some of the herbs, it's really their anti-inflammatory action that can help with their mood lifting effects as well. Excuse me, certain vitamin deficiencies or mineral deficiencies can be involved in depression. So vitamin B12 deficiency can present like depression and or dementia. Low iron can be really mood altering, mood lowering, as well as vitamin D, which we'll talk about later as well. And then, of course, there's a plethora of hormonal conditions like low thyroid or high thyroid function, perimenopause and menopause, PMS and PMDD, which is a more severe form of premenstrual disorder, can all present like a mood disorder as well. So sometimes treating, if it's a iron deficient depression and you don't know that you have iron deficiency, an antidepressant isn't going to do that much. It's not necessarily going to give you more energy or more joie de vivre because it's not giving you more iron, which is the underlying need there. And then all sorts of sleep disorders, and specifically sleep apnea can cause low mood as well. So if you're not getting proper rest, that can interfere with your ability to have, I guess, up up moods, good moods. A little bit of physiology review when it comes to the neurotransmitter system. And usually we see these images, or when I see these images, my head goes straight to the brain. It's like, okay, this is happening in the brain, because that's kind of what we were taught, that those neurons or neurosynapses with the neurotransmitters are all in the brain, but now we're learning that actually more of the neurotransmitters are in the gut. So what's happening in the gut can be reflected in the central nervous system and in mood as well. So on the left, you see the nerve cell, which has these long neuronal extensions from them. And then where they meet, where one little finger meets the next neuron is a synapse. So one neuron is sending a message from the center of the brain or the central nervous system along this track. And then it gets communicated at that synapse. And the synapse is the gap where all the action happens. So, in that synapse is where the neurotransmitter is produced. And a lot of times we'll use serotonin as the example in this neurotransmitter. So if you see on the right, the top um, neuron is sending the message. So the neurotransmitter is coming down into the receptor. And let's just say that serotonin, and the receptor gets filled. And then at the cell where it's being received, something happens. Some action occurs. There's a cellular response, and then an enzyme comes along and breaks down that neurotransmitter. Well, meds or herbs that we refer to as serotonin reuptake inhibitors inhibit the degradation or the reabsorption of that. See where some of it is being transported back up into the neuron. The reuptake inhibitors will block that transporter so that there's more of that serotonin or more of that neurotransmitter in the synapse, in the area, so there's more action on receptors. So you'll hear me talk about selective serotonin reuptake inhibitors a lot tonight, or SSRIs, and most of the meds that are known as antidepressants work in that synapse by blocking that purple transporter within the synapse, but some of the herbs do as well. So I just thought I'd go through the kind of physiology of that, so that you understand where it's kind of acting when I talk about it a little later on. So the feel-good neurotransmitters that I'll refer to over and over again tonight, the happy chemicals, serotonin improves the mood. In some ways that we know will boost this is more time outside, eating healthy, sleep. Dopamine is that like push or increased drive neurotransmitter. So taking some time off from the screen, doing focused work can help with that dopamine. And oxytocin is that neurotransmitter that gets produced when there's increased connection, or sometimes it's referred to as the love hormone. So, if you want to help to foster your oxytocin, you can perform acts of service, physical touch. So, like massage, for example, can increase oxytocin. Um, Practicing gratitude, like a gratitude journal, has been shown to increase oxytocin, and active listening can also help increase oxytocin levels as well. And then endorphins are those feel-good neurotransmitters that really help to like bring your shoulders down and reduce stress. So exercising, stretching, hydrotherapy like baths and saunas can also increase those endorphins as well. So, some of the lifestyle factors that are important if you're feeling sad or have a suspected mood disorder, we talk about digestion and nutrition. So, you may have heard like you are what you eat, but you are what you absorb. So, making sure that your digestion is functioning well is an important part of supporting mood. And then you are also what you eat, so it's important to have the building blocks. So a lot of um, people have a low protein breakfast, or a lot of people are now skipping breakfast altogether, which works really well for some people. But if people are low energy or low mood, I do recommend that they have protein in the morning within an hour of waking up, a good portion of protein, because protein is made up of amino acids, like in a chain together, and most neurotransmitters are made up of chains of amino acids. So if we don't have those building blocks to make those feel-good chemicals um, coming in on a really regular stream, we either have to break down our own muscle to get to them, or we're running short. And then sometimes, if they're essential amino acids, we can't break down our own muscle to get to them. They have to come in through the diet. So I do recommend like 20 grams of protein within an hour of waking. So that could be like 3 eggs, or like a high protein, like Greek style plant-based or animal-based yogurt, ground flax seeds, chia pudding, adding hemp seeds to a smoothie. So there's a lot of ways to get that high dose of protein in the morning. The Mediterranean diet in clinical trials has been shown to decrease depressive symptoms as well, especially in patients with those high inflammatory markers. So, like if there's on your blood work, if the doctor or the nurse practitioner or the naturopathic doctor who is interpreting your blood work points out that, oh, you're looking like you have some inflammation, even though you're not feeling inflamed. So you might not have muscle pain, you might not have joint pain, but you're showing signs of inflammation, usually with CRP or ESR. Those are the main inflammatory markers. A Mediterranean style diet has been shown to decrease the inflammation, and also has shown to reduce depressive symptoms in people with those higher inflammatory markers. So Mediterranean diet is, like a very high plant phenol based diet with lean protein, lots of olive oil, lots of leafy greens, lean or moderate fat dairy. There's a lot of information out there on the Mediterranean diet, but it's basically a whole foods, non-processed, high plant diet. And then there are also some specific foods that have been shown to have antidepressant effects as well, which include dark chocolate. So the dark chocolate is very rich in polyphenols. such as procyanidins and epicanthins, and those can lower depressive symptoms in some studies in the lab. It hasn't been duplicated as much in human clinical trials, but they are seeing that the dark chocolate or cacao can help with depressive symptoms in lab studies, as well as bananas, which are also rich in polyphenols. But bananas also contain a fair amount of tryptophan, which is the amino acid that is a precursor to serotonin. Of course, we know that exercise or movement is also very mood supportive. So there are several meta-analysis studies that show that exercise is as effective as medicated antidepressants for mild and moderate depression. And both strength and aerobic exercise can help. So 30 minutes of walking 3 to 5 times a week, or strength training 2 to 3 times a week can be as effective as taking an antidepressant. So oftentimes when I'm suggesting herbs for mood, which have that antidepressant action, um, I'll also really, really encourage a gradual return to a movement routine, but sometimes the chicken has to come before the egg. So sometimes someone is just not feeling motivated or well enough to start exercising. So to get the benefits from the exercise, so the herb will kind of get them there. And that's what I love about combining the therapies. Tai Chi and yoga are also really helpful for reducing stress. We know too that social connection is really, really important. Isolation is one of the strongest predictive factors for depression. So, support from others lowers stress and it increases dopamine and oxytocin. So, those two neurotransmitters, just getting some support, whether it be from a friendship or a support group. It can really help with that mood support. And one hack that I always like to recommend is to combine two of those lifestyle factors. So you could combine the exercise or movement with social time by having an accountability partner for your evening walks. So you get that social connection and the movement benefits together, and then you can add an herb or a medication to that as well. So you're covering a lot of ground. One of the great ways to support mood as well is to ensure quality sleep. So sleep improvement programs, so just like sleep habits, or we call it a lot of times sleep hygiene, has been as effective as therapy for many when it comes to mood support. And when it comes to sleep, consistency actually matters more than duration. So if you're consistently getting good sleep, but it's only 6.5 hours a night, that's actually better than someone who sleeps 4 hours one night, 6 hours another night, 9 hours another night. So you're getting cumulatively enough sleep, but it's better just to get a consistent amount. And that ties back to our natural rhythms, our physiological rhythms throughout the days, which are referred to as circadian rhythm. So that structured daily routine reduces the overall load of stress, and then that helps to optimize the production of dopamine and the regulation of dopamine, which is that drive chemical. So again, if we're thinking about exercise, we're probably going to be more likely to have the motivation to exercise if we've slept well. Never mind the energy, which will also be better if we've slept well. So some of the ways that we can really support those circadian rhythms are to go to bed and wake up at the same time most days, to expose your eyes to morning sunlight within an hour of waking, and that's a hard one for so many routines in North America. Um, I really, really advocate, having your tea or coffee outside, bundled up in the morning to get that sunlight as long as it's light while you're doing that. It won't work through the window, so you can't sit by the window or in your car and have your tea or coffee. You have to be outside without window panes or blue blocking glasses to get that circadian rhythm benefit of the sunlight. And we also want to limit screens, so shut them off 1 to 2 hours before bed. I usually recommend 1 hour. If you absolutely can't do that, then at least wearing the blue blockers then. So you're blocking out the blue light, which implies daylight. Um, can be can be more, I guess, like of a middle ground than if you can't shut off the screen at all. If your screen is your like dedicated wind down time. And also when it comes to the circadian rhythm, avoiding long naps. So cat naps are okay when they're really, really needed, but we don't want to do like a really, really long nap because that'll disrupt our rhythm at night. Um, Meditation can also be helpful in that it reduces rumination, so like those repetitive thoughts or the thought train or the anxiety train. It improves hormonal regulation, and it's also found to be effective as therapy for relapse prevention in depression. So I promised I'd get into some of the vitamin D. So we talked about vitamin D in terms of the immune system on Thursday night, but vitamin D can really affect the mood as well. So vitamin D is involved in neurotransmitter regulation. It affects serotonin, dopamine, and norepinephrine, which is one of those endorphins, so like energy, focus. It helps the enzymes that convert tryptophan to serotonin. So, low vitamin D theoretically may impair serotonin signaling, and vitamin D has anti-inflammatory effects. And we know that depression or low moods also oftentimes involves excess inflammation. So vitamin D does that by lowering those pro-inflammatory cytokines. I mentioned those, I talked about those a lot last Thursday. It supports overall immune balance so that we don't have an overactive branch of the immune system. And it helps to protect neurons, so it's considered neuroprotective. Um, Vitamin D also helps with hormone balance. And linking back to what I was just discussing, it also helps with circadian influences. So vitamin D can help regulate that, what we call the HPA axis, so the hypothalamus pituitary adrenal axis. So a lot of our internal hormonal signaling happens along from that hypothalamus to the pituitary, which is like the master hormone gland, down to the adrenals, which are like the stress hormones. Um, it also helps to establish sleep rhythms. I usually recommend that you take your vitamin D in the morning. It is the sunshine vitamin, so that helps with establishing that circadian rhythm. And it helps with hormone balance. So vitamin D is involved in hormone production as well. So the better vitamin D regulation, theoretically and with research, the more emotional stability. Uh, so we know that low vitamin D is associated with higher depression risk, seasonal affective disorder, and worse mood scores in chronic illness. And we know that if we supplement with vitamin D, it helps those things the most if the person is deficient. So before supplementing, if they're deficient, we see most improvement once we supplement. So if someone's not low in vitamin D, supplementing isn't necessarily gonna boost the mood as much as if they are low. Um, we do know that it can be similar in effect to antidepressants in mild to moderate depression when someone is low at baseline. And it works best, supplementing vitamin D works best when combined with exercise and therapy. So we do get vitamin D from the sun, but we live in Canada and we just don't get much in the wintertime, if any at all. So I really do recommend supplementing vitamin D because of that. There are some vitamin D fortified foods, and mushrooms are naturally high in vitamin D, but you have to eat so many of them to get 1,000 IUs that you'd probably have to have your own mushroom farm or a friend with a mushroom farm. Um, Oh, and we do have a vitamin D in an MCT carrier at St. Francis Herb Farm. It's the same product in two different packages. So the vitamin D for kids and the vitamin D for adults are both 1,000 IU per drop. And they're preserved with rosemary oil in that MCT oil carrier. So it is a fat soluble vitamin. So the MCT from coconut oil helps us absorb it that way. So now it's time to meet the herbs, what we've all been waiting for. Excuse me. So holy basil is a really, really gentle herb. It's one of the few adaptogens that is as effective as a tincture and a tea. So, an adaptogen is an herb that helps our body adapt to stressful situations. So, it both regulates the nervous system and it helps to act as an adaptogen for the stress hormone regulation or cortisol regulation. Traditionally, we think of holy basil as an herb that's stimulating in the morning and calming at night. And traditionally, it is considered an antidepressant. It influences several of the neurotransmitters, so we know that it helps to modulate GABA to promote relaxation and reduce stress. And you can feel that if you take some of the tincture or if you have the holy basil tea, it is very aromatic, so it has that essential oil effect that happens really quickly when we experience the scent of holy basil. So that GABA calming, but it does also impact serotonin, dopamine, and those stress-related hormones, norepinephrine and epinephrine. So again, it helps to improve the mood, but also helps our body adapt to stress. So it's a really great versatile herb because it has that adaptogenic effect as well as what we call the nervine. The nervine is like a herb that affects the nerves, and it's usually in a calming nervous system way. Here is one of my absolutely favorite herbs. I love rhodiola as a single. It's really great in terms of its effect on perimenopausal and menopausal people because it is a selective estrogen receptor modulator. So, like we're talking about how certain herbs or meds will affect the serotonin receptors. Rhodiola and many other herbs and meds affect that estrogen receptor. Um, Rhodiola also works on serotonin, but it hasn't been shown in clinical trials to be as effective as SSRIs, but it has a lot fewer potential side effects. Caution to know about rhodiola is that it does act on dopamine, and so much so that it is contraindicated in bipolar disorder. So, if you suspect that you have bipolar disorder, or if you've been diagnosed with bipolar disorder, rhodiola isn't the herb to try. But otherwise, it can be kind of like a brain stimulating, focus enhancing, but also mood supportive herb. And again, it is one of those well-known adaptogens. It was one of the first ones that researchers came across in terms of it being an herb that can really enhance mental and physical performance when someone is under a lot of stress. You probably know about ashwagandha. It's a very well-known nervous system adaptogen. Um, one of the kind of traditional things that is said about ashwagandha is that it smells like a horse, but if you take it over time, you'll have the strength of a horse. I don't find it smells that bad. Um, but it is in a tincture can be an acquired taste. It is also known to be a sleep inducer. It's been used traditionally as an aphrodisiac in both women and men, so it has that libido enhancing effect. And we know now that enough ashwagandha will increase testosterone in both men and women if it's needed. So it's like a hormonal adaptogen. So that's probably why it was traditionally used as an aphrodisiac. I learned ashwagandha a little bit in naturopathic college. It wasn't like the queen herb back then. It was one of the many adaptogens we learned. It's gained a lot of popularity since I graduated from naturopathic college 22 years ago. But I really learned about it at a herbal conference years ago in New England, where the person who introduced it called it the key to perimenopause. So that herbalist really found it to be the most effective herb for treating perimenopause. And it's really great because the active ingredients in ashwagandha are steroidal lactones, and they act similar to our own steroid hormones. So that's how it's able to really help to regulate like the female associated sex hormones, but also testosterone. So it helps support the glands that produce sex hormones. In human studies, as far back as the 1960s, it was found to be a calming sedative, so it helped to improve blood pressure, lower anxiety. There was one study that was done years ago that showed it was as effective as placebo for obsessive compulsive disorder. Sorry, more effective than placebo for obsessive compulsive disorder. And in the lab, we've discovered that it also affects so many of the neurotransmitters. So GABA, glutamate, serotonin, acetylcholine, which is the neurotransmitter associated with memory. It also affects the opioid receptors, so it can be helpful in some instances for pain, and the corticosteroids as well. So again, it's because those steroidal lactones are the active ingredients. It's also been shown to be antioxidant and anti-inflammatory. So really, no wonder it's the key to perimenopause, right? It's got such a broad action. Um, I love to start with it for an anxious woman in perimenopause with poor sleep. I find that ashwagandha works wonders for them. Our capsules at St. Francis Herb Farm are made from KSM 66, which is a patented molecule of ashwagandha. And the reason we've chosen to do that is that it is a more absorbable as a dried extract or as in a capsule than the dehydrated tincture. And it also makes a really, really potent dose. So we can get a very high dose in the capsules, and we're able to make the claim scientifically, like on our labels, that it increases testosterone. So we want, it's one of the only natural remedies that will increase testosterone if we want testosterone increase. So it's not going to turn into a steroid in people who don't need higher testosterone. You can't take it to build massive muscles like injecting testosterone. But if your testosterone production is lulled, it can help to bring it up to normal. Um, One of the only kind of side effects or effects that you need to be cautious with ashwagandha is that it can affect the thyroid. And so some people love to use it as a thyroid enhancing herb. So it can stimulate the thyroid. So you want to be cautious if you already have a high functioning thyroid. Some people use caution with it for Hashimoto's thyroiditis, the autoimmune condition that affects the thyroid. And it can also enhance the effect of benzodiazepines like Valium or Ativan at high doses. So you just don't want to take a lot of benzodiazepines or a regular amount of benzodiazepines and add a lot of ashwagandha to it because it could be too sedative, and we don't want over sedation. There have been some more recent studies that show increased liver enzymes with ashwagandha, and I think that is probably in higher doses, and probably multiple medication. But because of that, there are cautions with combining ashwagandha if you already have elevated enzymes, or I say use caution in cases of polypharmacy. So if you're on a lot of meds, ashwagandha probably isn't going to be an herb that you want to add into the mix because of that effect or potential effect on the liver. So this leads into one of our most favored formulas at St. Francis Herb Farm, and that's stress. So it's our adrenal tonic or our adaptogenic tonic. Some people who really, really benefit from this are people with going through increased periods of stress, like students, professionals with high work demand, athletes, especially endurance athletes, because a lot of the herbs in here are adaptogens. It helps to support optimal performance and reduce the physical stress on the body. Those going through a particularly stressful time or seasons of higher stress, so during the holidays, or if you're prepping for a wedding or adapting to a new job, um, on outside stress or inside stress, the stressed formula can help you adapt to it. So this is a great formula. I find a lot of adrenal blends on the market to kind of be overly stimulating because they contain those like strong adaptogens like the ginsengs, which are great when they're needed and in their own right, but for someone who doesn't necessarily need them, they can be too stimulating. Um, as well as stress is licorice free, which is in a lot of adrenal blends as well. So it contains rhodiola, which I've talked about, holy basil, which I've talked about, ashwagandha, which I've talked about, as well as elithro, which is Siberian ginseng. It's a adrenal adaptogen. Milky oat seed is just like a really nice calming nervine. And Schisandra is a fantastic adaptogen that also serves as a liver tonic. It's called the five flavor herb, so it kind of helps round out the flavors in this tincture as well. And it's used a lot in kind of like hormonal balance formulas because of that liver support, where liver is involved in hormone production and recycling as well. So I'm sure you are anticipating this if you're familiar with herbal medicine at all in terms of mood support. It's the best known herbal antidepressant, St. John's wort. Um, it was called the Blessed in Wales traditionally because it was so helpful. Um, it's it's used throughout historic Europe as a nervous system tonic. And it was named St. John's wort because it oftentimes bloomed on St. John's Eve, which is like the summer solstice. In the lab, we've seen that it affects neurotransmitters, especially serotonin, but also dopamine, MAO, glutamate, acetylcholine, the opioid receptors, noradrenaline, and melatonin as well. So it's affecting a lot of the neurotransmitters and like nervous system action. And there are over 30 human clinical trials with this herb, which is pretty rare when it comes to herbs to have that much research backing it up. It's been found to be as effective as Prozac. For mild to moderate depression, we need more clinical evidence for severe depression. We haven't seen that as well. but it's also showed in controlled studies improvement in menopausal depression and anxiety associated with depression. Um, there are a lot of cautions when it comes to St. John's wort because it's metabolized in the same liver enzyme system as a lot of meds. So I think I read earlier when I was preparing that over 50% of meds would have a caution with St. John's wort. Yeah, 50%, about 50% of conventional meds. And that's because of that cytochrome P450 um, enzyme system in the liver where it's metabolized. So you really have to be careful if you want to try this herb and you're on meds to look for it on the label. All of our contraindications or cautions are on the label and on the website. Or you can talk about it with your prescribing doc or your pharmacist as well. Some of the other things that we can see with St. John's wort is nausea, so that's just something to be aware of, although I've never, very rarely seen it clinically. And in a very few patients, I've seen it cause increased photosensitivity, and that is a documented side effect. So fair, like me, pink-skinned blue-eyed individuals can experience an easier sunburn or easier sun sensitivity when they're taking St. John's wort. So just a few things to be aware of. It's such a great herb, but it's not one that's easily prescribed because basically if anyone is on SSRIs, a lot of the cardiovascular meds, contraceptive meds, blood thinners, um, immunosuppressants, they can all have that caution because they're using the same liver enzyme system. So they could make the meds less effective and they could make the St. John's wort less effective. So they're not good in combination, which again is a real shame because it's such a great herb. We do have a formula that is kind of built around St. John's wort called Clear Day at St. Francis Herb Farm. It has rhodiola, St. John's wort, happiness tree, which is herb that's been used in traditional Chinese medicine to nourish the heart and calm the spirit. So it's been used traditionally to address symptoms of anxiety and depression and insomnia and grief. Um, but there aren't that many human studies published in English that support how it acts as an antidepressant. We just have this like great traditional historical use, which is enough, for a lot of herbalists and naturopaths to try it in patients as well. And I've seen great success with happiness tree and or this formulation. It is thought to be a serotonin modulator, hypothalamus pituitary adrenal regulator, a neuroprotective, and anti-inflammatory. And then this or this formula is rounded out with passion flower, one of the great nervine or nerve tonics. That's the picture you see on the box. It's such a pretty herb. So passion flower kind of completes the clear day in that it calms, brings down the anxiety, but also passion flower. So, some of the great nervines or sedative herbs that can support sleep that aren't in this formula, but can act similarly, like valerian and skullcap, can also kind of fall into the antidepressant herb category as well, because by enhancing good sleep patterns, you can get an anti depressant effect. And they can also modulate those mood neurotransmitters as well. I just didn't have time tonight to talk about all of the mood herbs. One you're also most likely familiar with is black cohosh. Um, we see in studies mostly from Germany that black cohosh can enhance the effect of serotonin, selective serotonin reuptake inhibitors. And also in studies, it's been shown to be as effective as estrogen in decreasing depression in menopausal women after 3 months of use. Other studies show reduction of anxiety, irritability, and hot flashes in menopausal women, and improvement in the quality of sleep in postmenopausal women. So we do know that black cohosh does affect serotonin, dopamine, noradrenaline. It can also help with progesterone production. Um, and it can have that antidepressant effect because of, or we think maybe we don't know exactly how it works, but we think that there's an alkaloid in it that may be responsible for its antidepressant effects called methyl serotonin. It also has the co-benefit in menopausal women of being a herb that's been shown to decrease or reduce osteoporosis. So great choice for mood support during menopause in conjunction or combination with hormone replacement therapy, or if someone has contraindications or trepidations about taking hormone replacement therapy. Turmeric, I thought I would also just round out the discussion with. It's nature's anti-inflammatory, and because we know now that inflammation can contribute to depression or low mood, this well-known herb from the ginger family, a lot of traditional use in India. We know it as a very yellow cooking spice. What we also know is that its medicinal constituents are not very water soluble. So it tinctures well, and that's again why we use that Marevia, which is the patented molecule, because it makes it more fat soluble and more absorbed in our capsules. So there are human studies that show that after 6 weeks of taking turmeric, it can be as effective as the SSRI or antidepressant Prozac. It's also been shown to help alter neuronal growth. It's been shown to be helpful with people with PTSD and improvement in memory, especially now we're learning that a lot of times memory can be interfered with because of inflammation. It increases dopamine, boosts glutamate and serotonin. So this is a great antidepressant to try if you know that your mood is being altered by inflammation. So the vitamin D and turmeric may be the solution versus St. John's wort and holy basil if you know that it's coming from, or the mood is coming from uh, inflammation. The mood decrease is coming from inflammation. So that concludes my chat tonight. I know I covered a lot of information. I'm going to move on to the questions. So I'm just going to check the Q&A and the chat here. So just give me a second.
You need a hand today reading them off.
Oh, I didn't know you could, I didn't know you could see them tonight, Johnny.
Yeah.
Yeah, sure. Johnny is
Okay.
from St. Francis Herb Farm as well.
So we have a few questions in the Q&A and the chat. So we'll start with the Q&A and then I'll move over to the chat. So the first one, I have some kidney damage and a lot of my supplements I take to stop because they are not kidney friendly, i.e. turmeric and 5-HTP. Is your product something that is safe for me to take?
It would say on the label, in really, really tiny font, which is almost exceeding my reading glasses, but on our website, in much larger font, if there was a caution with kidney disease, or a contraindication. With kidney disease, it's potentially something that you really, really, really don't want to um, take something in error. So you could go to your pharmacist if you had like questions about the caution, because sometimes it'll just say like consult your doctor. And it might just be, one case was reported 10 years ago, but we still have to mention that you should check the safety. So our products aren't unsafe as a general for people with kidney disease, but there are herbs that would be contraindicated with kidney disease. I hope that answers the question.
Um, is overnight oatmeal with chia seeds with feta as additional protein that is added in the morning, is it an anti-inflammatory breakfast?
Overnight oats with chia seeds and feta. So
Yeah.
as long as you don't suspect that feta causes inflammation for you, because about 40% of human adults have inflammation from dairy, as long as you seem to be great with dairy, it should be anti-inflammatory, high protein breakfast.
Okay. Can holy basil and or ashwagandha be taken with an SSRI?
Um, Holy basil can be. Um, Ashwagandha, it's one of those ones where it says like discuss with your doctor. So it would depend on your liver enzymes and what else you're taking from a medication perspective. So I would say that's one that you would have to be cautious with.
Okay. Every time I take ashwagandha, it makes me feel really weird. Profuse sweating, dizziness, etc., as if my blood pressure or sugar were really low. What could explain that?
I would say it's affecting those steroidal lactones in the wrong direction for you. So your hormonal picture is not responding to what ashwagandha is doing to your cortisol well. Usually ashwagandha will help to balance cortisol. It's more likely to decrease it. So it may be that your cortisol is already quite low and you don't need to decrease it more. That would be my guess without knowing your specific case or seeing your specific numbers. Luckily, there are a lot of other herbs out there, so just move on from the ashwagandha.
Um, how would black cohosh help with reducing osteoporosis mechanism?
We don't know for sure, but we suspect that it has a even though it isn't a selective estrogen receptor modulator, it has an action similar to those. And so it has been shown to help with remineralization of bone tissue. So we don't know the exact mechanism, but we think it's similar to how a phytoestrogen or a SERM works in terms of acting like an estrogen to help those minerals get into the bones.
We did have a question. I couldn't listen to all of this. Am disappointed. How can I get the replay? So I can actually answer this one. So Healthy Planet does take the recordings of the webinars and post it on their YouTube channel.
I'm
So
glad, I'm glad you had the answer to that, Johnny.
yeah, so if you do want to replay this, or if you missed some portions, you can always go on their YouTube channel and replay it.
Great.
Of what you spoke about tonight, which would help with water retention?
Hmm. Good question. Turmeric may, because it's anti-inflammatory, and a lot of times inflammation is holding on to extra water in the body. So that's probably where I would start. Taking the adaptogenic blend or the adrenal blend, the stressed may as well, because all of those herbs, although they're really functioning on the adrenal level, they may also affect the organ underneath the adrenals, the kidneys, in a positive balance way as well. There are a lot of herbs that are more diuretic in action. Dandelion leaf is the one that I think of first. So as long as you're not on a, a prescribed or medicated diuretic, I would say focus specifically on an herb for that reduction, maybe as a tea, and then a different one for mood. But you could combine them. Like I said, they're easy to combine together, and there usually isn't contraindication in terms of combining herbs. So you could do a dandelion turmeric, for example.
Next question. I am a male in my 30s. I had lots of loss in life, and I'm suffering from MDD, major depressive disorder, along with social isolation problem. I tend to avoid people. I'm on Trintellix, an antidepressant SMS class, 10 milligram once a day. What supplement can I combine to help with low mood and grief in general with Trintellix?
I don't know off the top of my head which one would combine safely with your med. Um, I know that in general, Happiness Tree and Holy Basil are well tolerated. I don't know specifically for you. So that would be just something to go to a pharmacist or a naturopathic doctor. They have a database, they could look it up and help you out. More specific to your very specific medication question.
Should you take K2 with D3?
Absolutely. Great idea to wash those D3 drops down with some leafy greens. Take them with your green smoothie in the morning. If it's cold out and you don't want a cold green smoothie, just making sure that you're getting lots of leafy greens in your diet as long as you can convert. The vitamin K should be fine. If you do know that you have low bone density, the K2 helps to get the D3 into the bones. So if you're taking vitamin D specifically for bone health, you want to supplement the K2. I would say if you're taking it for immune modulation or mood, anti-inflammatory, you don't have to worry quite as much as supplementing the K2.
Next question. How long can you safely consume ashwagandha?
Um, that depends. Do you happen to know, Johnny, what it says on the label? I
Uh,
can't think of specifically if it has a timeline on our label, but generally we do recommend cycling herbs if taken chronically. So you would want to do it for like a bottle or the complete your cycle and then take a week off. That goes for any of these adaptogens because it helps your body adapt and then reinitiate. And because there were some studies that showed that liver enzyme elevation with ashwagandha, I usually recommend that people have their liver enzymes tested after 6 months of use. If the liver enzymes are just fine after 6 months, then to continue long term with that cycling of either every month take a week off or every three, 2.5, 3 months taking a week off.
yeah, I just checked the label for the tincture and the capsules, and there's no like time. It doesn't say like, only take for a month.
Yeah.
So,
Yeah, it's a great tonic herb. So it's one that like I really like to see someone on for 3 months before they really expect a real adrenal tonic shift from it. Sleep, you can see the first night you take it. Energy production, those more like adrenal tonic can take a little while. Its anti-anxiety effects can be really, really quick as well. So it kind of depends on what you want to get from it, but safety wise, as long as you're not one of those people that get the elevated liver enzymes from it, there'd be no reason that you couldn't take it long term.
could you repeat the effect of ashwagandha on the thyroid?
So it is generally a stimulating herb for the thyroid. So traditionally it's been used as a thyroid support because it has those steroidal lactones. It can just support any hormone producing gland in the body. But some studies have shown that so if you have already have a high functioning thyroid like hyperthyroidism or Graves' disease, or you're on the borderline of that, you don't want to take ashwagandha because you don't want to overstimulate it. And then there is kind of a concern with some herbalists with a low functioning thyroid. If the reason for the low function is Hashimoto's thyroiditis, which is the autoimmune condition that affects the thyroid, because within that Hashimoto's thyroiditis, and I didn't say this before, but you'll see periods of hyperfunctioning thyroid sometimes within the low functioning of Hashimoto. So you don't necessarily want to be giving something that could stimulate it during those periods of high function. Unlike, being on the med that just more keeps things stable, it is a stimulation to the thyroid.
Are there any complications to use stressed formula with bladder?
Mm. I guess again, just when we're talking about thyroid, and so bladderwrack being, a thyroid affecting herb, and ashwagandha being a thyroid affecting herb, you would just want to monitor how it's affecting your thyroid. So again, caution, or, supervision maybe with Hashimoto's, and you wouldn't want to overstimulate the thyroid by doing too much bladderwrack with ashwagandha as well.
Are there any blends that would support first responder shift workers who can't get regular sleep to help with depression, adrenal fatigue?
Ashwagandha. That would be my first herb. Did they ask for a formula or an herb? A suggestion?
Any blends? So,
Yeah, so I would say that the stressed blend um would be great for that because it helps support those adrenal glands. So many of those herbs are mood supportive, but also like stress supportive. So as long as it's not contraindicated for you personally, I would recommend the stress formula.
what herbs can help with arthritis and osteoarthritis?
So we are just going to address herbs tonight that are pertaining to mood, but the anti-inflammatory effects of turmeric are the where there'd be good overlap with mood and arthritis, as well as if the joint pain really came on during menopause. Black cohosh can be a great adjunct to joint pain and mood support at the same time.
Which is better to use, get better results from turmeric powder or the root itself?
So the powder is from the root. And so as long as you're kind of taking it in a fatty way, it's more absorbed. So if you do take the powder, like the food, I recommend that you take it with fat. So in a nice greasy chicken curry, or traditionally, it can be put in milk, like a golden milk, because that fat helps with its absorption. Again, the powder that we use, which is in the Curcumin Plus capsules, um, are designed with a fat layer so that they're very absorbed and utilized that way.
Okay. A few more questions here. Can you talk a bit about the benefits of skull cap?
So skullcap is one of the herbs that we think of as a nervine primarily, so it helps with those GABA receptors and it's calming. But there is some research that shows mood support in terms of depression as well. So whether that's because you're getting better sleeps and you have lower anxiety, or because it does affect the serotonin receptors, we're not quite certain, but it's a great nervine herb.
Okay. Do you guys have any blends with holy basil and happy tree and nothing else? I don't believe so.
No, but you can, that's the beauty of tinctures. You can make yourself a blend. Get happiness. Oh, actually, happiness tree by itself is not available at St. Francis Herb Farm. So you would have to do the clear day, um, and then add the holy basil.
Yeah, because I believe the happiness tree is only available through practitioner.
As a single, but it is in that clear day formula. Yeah.
Right. And then there was another question about the promotion that's going on Healthy Planet's website. So yeah, if you go to their to healthyplanet.ca or healthyplanet.com, sorry. Yeah, all our St. Francis Herb Farm products will be on sale 15% off. So I'll just put the website in the chat here if anyone wants to grab it. Healthyplanet.com.
Thanks, Johnny.
Can stress be used with someone who has high blood pressure and on statins?
Can you pull that up? I don't want to give wrong information, and I don't have the contraindication on my oh, maybe I do. Sorry, I do. Stress, so as I mentioned, because of the rhodiola, it is contraindicated or cautioned with bipolar. And so it's contraindicated with antidepressants, hormone replacement therapy, birth control, heart and blood pressure, and blood thinning medications. So again, it's one of those cautions. It's not a contraindication. So it would be one that you'd want to discuss with whoever prescribed those meds, and or your pharmacist. The contraindication is pregnancy and breastfeeding for this formula. Otherwise, it's kind of like a look at the specific herbs that you're on, specific herbs that are in the formula with the specific meds that you're on, and someone other than the webinar host has to determine whether those are safe for you.
Okay. Any other final questions for Dr. Blossom before we log off? Nope. Going
Great.
once, going twice. Okay. Well,
Well,
thank you.
thanks.
Awesome.
Well, thanks for joining in tonight. I hope it was informative. I thought it was going to be short, and I actually went on and on and on. There's so much information. So if you have any questions after the fact, you can send them to info@stfrancisherbfarm.com, and someone there should be able to address them. And even some of those like technical questions, we do have a naturopathic doctor on staff there who can give reasons for contraindications with meds as well. I think the chat is increasing, so I don't know if those are questions or just good nights.
It's more thank yous, very
Okay.
informative,
Okay.
learned a lot.
Great.
I guess another question that just popped up. How do I find an ND who supports using your products?
That's a good question. You could send info at St. Francis Herb Farm, your location, and then they could tell you which professionals in your locale are big users of our products. Wouldn't you say, Johnny?
Yeah, that'd be the best bet. Because obviously they have to be in the province that you're in.
Hmm.
So,
Hmm. Yeah,
I know a lot of people ask Dr. Blossom, hey, can you take me on as a patient? But you're in New Brunswick, so they have to be in New Brunswick as
they
well for
have to be in NB. Yeah.
that to happen. So, um, yeah, that'd be the best part. So yeah, any questions, info at stfrancisherbfarm.com. Anything about products too, like the staff at Healthy Planet stores are really informative as well. So if you ever want to, get out and visit a store, feel free to visit them and ask them any questions about our products as well. So
Great. Thank you. Good night.
everyone.